All right. Welcome everyone to today's webinar, Incarceration and Broken Family Ties, the Invisible Victims and Unintended Consequences. My name is Chad Sievers. I'll be your webinar moderator for today, and before I let our speaker introduce her topic a bit more and herself, I'm going to go over a few housekeeping items. If you'd like to ask a question during the presentation, please use the question feature which is found on the right side of your screen. And if you are interested in earning 1 CEU, just be sure to stick around to the very end. We'll have a code that's given. And if you're watching with a group today, just make sure each person emails me individually. And if you happen to be watching this at a later time on our YouTube channel, we only give CEUs during actual live webinars. So again, we will record this and we'll upload it to our website here in just a bit. And we are new to Facebook and social media, so if you happen to use those services, we frequently post information about future trainings, webinars such as this one, so be sure to check us out. And I think that's all my housekeeping items. I'm going to let our speaker introduce herself.
Good afternoon. I'm Rhonda Maddox, and I am a psychiatrist at Inspiration State Treatment. I'm the former medical director for United Family Services. United Family Services is one of the reasons that I got interested in this particular topic, because the overarching goal while I was working for United Family Services was to make sure that the family unit stayed intact and to support individuals who were involved in the juvenile justice system in a way that they could receive services, mental health services, substance abuse services in their community. And so as I worked with these individuals, I started to see a pattern that many of the individuals who were actually involved intimately in some juvenile justice issues actually had parents who were also involved in the justice issue. Today's topic will discuss the impact of incarceration on the family unit and community. We will discuss a little bit the rates of incarceration. We will also explore the impact that a parent's incarceration has on their children's emotional well-being and their mental health, and we will review strategies to reduce negative outcomes. Please send your questions in as we're going forward, and if I see that it's something I'm not going to address a little bit later, I'll go ahead and address it while it's on your mind. So as we talk about incarceration, one of the things that I need you to know is in the United States, incarceration was not, the United States was not always the nation that imprisoned more people per capita than any other country. Our rates actually started rising around the 1970s, and this was during the time of President Nixon's presidency. At that time, he declared war on drugs. Many of us attribute that to our President Ronald Reagan. By 2014, the U.S. held an estimated more than 1.5 million prisoners in state and federal custody. And that's not including those who are in community-based centers or who are on probation and those kinds of things. A lot of the numbers were driven by tough policies that mandated long terms for drug offenders and other criminals that were implemented under Reagan's watch, under Clinton's watch. The U.S. prison system has seen a dramatic upswing in incarceration rates since mandatory sentencing began in the mid-1980s, and many of us would be surprised to realize that half of the males, about 50%, and more than half of the females, about 59%, in federal prison were serving time for drug offenses as of September 30th, 2014. 50% of state prisoners had children younger than 18 years old, and greater than 60% of federal inmates had children younger than 18 years old. So we have a lot of children who have parents. And over the past, throughout a child's life, we have more than 5 million children who have at some point in their lives had a parent that was incarcerated or involved in the justice system, excuse me. Among those who are serving time, the rates of parenthood were higher in people who were Black or who were Hispanic inmates than they were for white inmates. And in part, this has something to do with some of the disparities in sentencing related to drug use. What you'll find when you look at some of the studies is particularly minority males are more likely to receive sentences that are equivalent to what for non-violent drug crimes than what white offenders would receive for violent crimes. And so as we're seeing these disparities in sentencing, what we're also noticing is there are disparities in the effects that are more likely for Hispanics and Blacks as it relates to their children's impact related to parental incarceration. So children experiencing incarceration of a household member, this has grown dramatically. According to Pew Charitable Trust, looking at the Center on the States in 2010, at least 2.7 million children in the U.S. had an incarcerated parent. We are literally living in the incarceration generation. In 1986, 10 out of every 1,000 children had a parent in jail. In 2006, 20 out of 1,000 children had a parent in jail. We're waiting for the results now, but what we do know is that this is drastically higher for people who are in minority communities, particularly with Black males and with Hispanic males. The growth, there's been a 77% growth of children with a parent in prison from 1991 to 2007. And there's particularly been an increase in women prisoners, which you'd probably be surprised to realize is a fast and growing segment of prison population, according to the Bureau of Justice Statistics. What does this mean? When you have this many people who are incarcerated, there are some invisible victims. Now, conventional wisdom would let us know that the people who are going to be impacted are obviously the children, but certainly the partners and the spouses are impacted as it relates to their marital bond, as it relates to their ability to lovingly take care of the children who are in the home. Whenever there's an increase in stress, of course, that impacts your parenting style, and particularly if you don't have an extended support system who are in your corner. It impacts grandparents. Many of the grandparents are left to take up the slack when their children go to jail, and also with children. So we know that it would weaken parent-child bonds and adversely impact child development. What we sometimes don't think about is the loss potential to the community. When you have a large population of people who could go on to be educated and contribute to the community, you never know exactly what it is they can contribute because that potential is lost. Most of the time we are hearing about, particularly in select administrations, we don't necessarily hear about the emotional side as much as the fiscally responsible side or irresponsible side as it relates to taxpayers. What are we paying in terms of prisons, jail costs? What are we paying for supportive services to support children, in terms of housing assistance, food stamps, foster care, insurance, those kinds of things. The average annual cost of incarceration in federal prisons in 2010 was $28,284 per inmate. The average cost at federal community centers was $25,838 in 2010. And we're talking about that as it relates to costs for taxpayers. And we're not even factoring in the cost of what it takes if a child goes into foster care. What does it mean in terms of the amount of services that then must be provided related to mental health services, those kinds of things. Sesame Street realized that more than 5 million children were, at any given time had a parent that was in jail during their from 0 to 18, and they addressed this in a really creative, useful way. Little children with big challenges, and talked about incarceration. Please Google that and find it, particularly if you're working a lot with children who have been impacted by this. Please, at this time, send in how the kinds of issues that you all deal with when you are taking care of children who are incarcerated, so that I can make sure at the end of the discussion that we can make sure to prioritize the kinds of issues that you're actually dealing with. And certainly if you have questions along the way, please jump in and type. I can't see your faces, so I don't know if you're yawning or if you're really excited and want to hear more. So as I've talked about, the invisible victims, where do the children go after a parent has gone into custody? And what does it look like? It's particularly bad for the child if they were present when the parent was taken away. It's particularly bad for the child if they come home from school and they have no idea where their parent is. I remember I'm married to a hunter, and when we were getting married, he told me he had 2 rules. We could not get married during deer season, hunting season, or football season. And so, while we were without child, I loved those seasons because it meant I got some extra shopping time. But after I got, after I had a daughter and she was small, I actually hated those times because it meant that I was taking care of her alone. And so I noticed my daughter was about 14 months old. My husband had gone, and she wouldn't eat. And the ladies at daycare told me that she was particularly quiet and she was playing to herself. And so the next morning I was trying to feed her and she wouldn't eat. And so I called my husband after I noticed that she was looking to the chair that he normally sat in. And she'd look to the chair and she looked back to the bed, and she looked to the chair and she looked back to the bed, and she just started crying. And this child was 14 months old. She didn't have verbal skills, but she was refusing to eat. She was isolating, and she was very tearful. And while of course I wouldn't diagnose her as depressed or whatever, but she was showing some signs of having her mood impacted, even at 14 months old, because we weren't able to tell her Daddy's going to be away for for 5 to 7 days. And so looking, that gave me an intimate insight into my daughter, 14 months old, can identify that someone that is a primary caretaker to her leaves without any warning to her, and it's traumatizing for her. What must it be like for the child who sees their mother or their father, driven away in handcuffs, or comes home to an empty house and there's nothing there? They didn't plan for it. They didn't discuss what was going to happen. They just land in somebody else's custody. And so where do the children go? Most of the time you think, perhaps if they're a married couple, they stay with, the parent that's not in jail. If they're single, maybe they go to the other parent. What the statistics show is, when the children are living with the mother, they don't actually go to the father like you might expect. Most of the time they'll go to the maternal grandparents, who are supposed to be living out their golden years, right? About a third go to the maternal grandparents, about a third will go to the paternal grandparents, and then they go to the father. So that translates into children more likely to be sent to live with their grandparents than their own father. And so that translates to they're without both their mother and their father. How traumatic. And lastly, if they don't go to the grandparents or the father, they may be taken up by the care of friends or of the mother. Now remember that I told you about 50% of the cases can be related to drug abuse. So think about who that parent has actually befriended and what their capacity to take care of children are. If birds of a feather flock together, are their friends, potentially people who are abusing drugs. So what happens to the children? Where do they go? Thank you all. You're coming in with the questions, and I'm seeing them. And as soon as I can actually read them, I may start to address them. But in any event, what happens to the children and the impact of where the children go to live really can have a large impact. Now, we are assuming that the children are actually in the home of one of their parents, but when you actually go in and you disentangle, what we've learned is a whole lot of the behaviors that, the offending behaviors that led to the incarceration have many times, and sometimes more than a third of the time, have led to the child not actually being in the home of the parent. And so they're being taken care of by maybe someone else, already. Now, the relationship that the child has with the parent before they go in directly impacts how traumatic this will be for them while they're away. And also pay attention to the fact that sometimes we don't tell the child what happened. So then there's this level, of am I abandoned? What happened? There's fear. There's living on the edge. There are a whole lot of things that happen as it relates to who actually has the child and what they decide to tell the child, because many times they're trying to protect them. Children of incarcerated parents are more likely to experience internalizing disorders, your depression, your anxiety, those kinds of things. They're more likely to exhibit behavioral problems than their peers. 70% of children exhibited symptoms of social and psychological disorders, aggression, hostility, withdrawal. Now, most of the audience are therapists, I think. And so what that means is, the caretakers don't bring them in and say, hey, I'm bringing them to see you because their parents went to jail or their parents went to prison. Many times what happens is they start acting out at school, their grades go down, and then they come in. And I can't tell you how many times I would have an aunt or someone come in because of the grades, and then as we're going through kind of our narrative to learn more about the child, it's an afterthought that they tell me the child's parent is in prison. And you really want to, as you're taking care of the youth, to not have these detailed conversations about what happened in front of the child. This is a good time when you hear that a child's parents are in jail to excuse the child and have them wait in the waiting room. And the grandparents and the aunts and the uncles will tell you, no, it doesn't matter, they know already. No. That is a time when you have a conversation with them, because you also want to support the primary caretaker in terms of assessing where they are, how they feel about those kinds of things, how much support they have, and then to encourage them, depending on the age of the child and the breadth of knowledge of what they should and should not say in front of the child about that. And the one thing that I can tell you I remember that resonated with me was a particular individual whose mother had gone to jail. And we say many times, the apple doesn't fall far from the tree. Or are you just like your mom? Or if you want to know what a woman is going to be like in her old age, check out her mother. And this person was absolutely fearful that she was going to end up like her mother. And as you all know, the stats really do suggest that there is a positive correlation with children whose parents have been incarcerated to actually be incarcerated themselves, even though they may not want to be anything like them. I'm going to take this opportunity to just pull up one of the questions that I see here. The question says, I've had extended family, grandparents, bring kids for therapy whose parent is incarcerated. The family does not want to tell the child where the parent has gone, and they think that it is easier for the child. The child now has no idea where the parent just disappeared to, and they often fear others will just disappear as well. Let's see. There is not a particular question that was asked, but what I would share with you as it relates to that, in the absence of knowing how old the child is or what the parents were incarcerated for, one of the things that I would encourage you to do is to help the grandparents process that. Now if the child is 3 or 4, maybe you want to keep that explanation really simple. But the whole issue of attachment and bonding, this will, if the child thinks, oh, they just abandoned me and they didn't want me, what does that mean for their self-esteem? That they're not lovable, that they're not wanted, that they're not treasured, or they're not valued, as opposed to thinking that the parent has no choice as to not to see them. It really can impact their feelings of self-worth and how they see themselves. The parents are supposed to show you unconditional love for who you are, but if you're abandoned by the people who are supposed to love you most, that can be very traumatic. So if they're very young, I've heard of the literature suggests and supports that the child and the parent actually do better when they have an opportunity to see each other. I'll tell you, I'm a little bit ambivalent about that. Depending, and I would encourage you to use your judgment. I can tell you, I've had parents who are insistent upon allowing a father who has been incarcerated for childhood sexual abuse to let their child go and be exposed to that. And that, whenever I hear that, it's frightening, and for me, it feels like neglect and endangerment. So it's really unique to the situation, and I don't, without some additional information, I'm not sure what more to go on. I'm going to go on a little bit more, and then I'm going to come back to the next question. And I may answer some of these questions, as I know that I'm going to answer some of these questions as I'm going through. So the unintended consequences. We talked about where children are likely to land. Now, realize as a child, you go through your teenage years and you act out a bit, right? And your parents, who love you unconditionally, expect you're going to act out because they acted out as well. Well, when you are not with a parent, when you're with a grandparent or a family friend and you're acting out, sometimes you don't get the benefit of that unconditional love and that remediation and that discussion. Sometimes it lands you in foster care. And so as the rates of female incarceration were increasing, it also coincided with a 30% increase in foster care caseloads between 1985 and 2000, and it's continuing to increase. And what that means is, children who are separated from family, there's not a lot of robust data that was, case controlled that we have out there to discuss whether it's better for children to be with their kin as opposed to foster care. But what we do know is having a stable, supportive, nurturing environment with unconditional love is really good for the mental health of those children. And so in foster care, many times the housing is very unstable. They may be with one foster parent for a couple of months. If they're particularly challenging, they may go to a group home. They may go, and so that piece of having some interface with foster care is definitely an adverse childhood event, coupled with a parent that is incarcerated, coupled with the lifestyle that parent was living before that child, before they were even, caught. All of those adverse childhood events coupled together impact the child's immediate health as it relates to mood, anxiety, behavior, but it also, studies reveal, impacts their long-term health well into their adulthood. As I looked at this picture, it was really heartbreaking for me, because unfortunately this is the story of, as I said, more than 5 million children can say right now that they've had a parent at some time in their life be incarcerated or in jail. The conventional wisdom lets you know that if a parent goes to jail, that is definitely traumatic. But a part of the reason that this is so traumatic is if someone's grandmother died, if someone's father died, you have support system in place, people to console you. Depending on what the reason was for someone going to jail, it can be very embarrassing if it was for murder or if it was for something like that. It can, you don't want to be judged by your friends, And so this particular quote really sums it up nicely in terms of the stigma that people who are living with parents who have been incarcerated feel. I didn't tell my friends where my mom was. I told them she moved away. I could talk to my grandmother and my dad about it, but it was hard for them too. I miss my mom a lot. I miss watching movies with her, bike riding with her. I miss telling jokes. Another unintended consequence, I'm going to read this quote. It was really very telling. I went to Jefferson my whole freshman year, sophomore year, second semester I went to Fairview. And in first quarter junior year, I went to Central. And then I went back to Jefferson my whole junior year because I was moving with my mom. See, when I was going to Fairview, I was staying with my auntie, and I moved with my mom my sophomore year, right when I switched. Then started off at Central because she, my mother, in Central District. Then I moved with my dad that same year, and then back to Jefferson the rest of my junior year. Now I'm at Walnut Grove, living with his dad, who also moved again. I really don't like it that much. I don't know it. It ain't my type of school. And this was a young man describing his history of school moves, which related to his mother's jail stay, but also to times of heavy drug use and to economic impact on their housing situation. And so, children who have family members, parents particularly, who are incarcerated or who are doing substances of abuse, their housing situation is very unstable. Kids of incarcerated mothers are at greater risk of dropping out of school. They're more likely to be incarcerated. And that example, that I gave you just a second ago, I wish that was not. I wish that was an outlier, but unfortunately, that is a very frequent occurrence in terms of the moves and the impact. Because parents don't go to jail at during the summertime or during Christmas break or during spring break. They go to jail whenever it happens, and so that can mean moving right in the middle of the semester or right before semester tests. So naturally, we expect that they would have feelings of loss. We know that they would have the experience of stigma that surrounded the parent's incarceration. There's perhaps some isolation because what was the relationship of the parent like with the person who's actually taking care of them? Is there resentment as it relates to having to, in your golden years, take care of someone else's child? The trauma of the parent-child separation, how did it happen? When did it happen? As the earlier person asked the question, do you even know that the mom is in jail or the father is in jail, or are you just thinking they abandoned you? What does it mean in terms of the social and economic strains that result from a parent's absence? In a two-parent home, you're less likely to have poverty than you are in a one-parent home. If one parent goes away abruptly, are you going to be able to make the house note? Are you going to be able to make the car note? Are you going to be able to do, these competing demands make the either parent who's still there more stressed, or the caretaker who steps in a lot more stressed? And when you're stressed, you're a lot more snappy. And so as a result of this, as a result of all of these kind of this instability, this living on edge, this not knowing what is going to happen next, perhaps the absence of nurturing, all of those things contribute to poor mental and physical health. Now, I'm going to jump right in over here, and we're going to answer a question as soon as I can see it. Great. All right. I have several children with parents who are incarcerated, and the main issue that they struggle with is the limited contact with the parent and the anxiety and anger that goes along with that. I don't necessarily see a question, but what that speaks to for me is a lot of what happens during sentencing is that many times people do not. You may be sentenced 4 hours away, and then the ability to get to that parent is compromised. There is a program in Hawaii, and the actual name is escaping me, but there's a program in Hawaii to where the interest of a family must be put first in the sentencing, and they have to take into account what is best for the family in terms of that. And I think before we leave, I'll probably be able to recall the actual name of that. But it's the first of its kind, as far as I'm concerned, or as far as I know about, to actually take that into take that into account. But I think it speaks to having some conversations with our legislators and educating them about the importance of the contact, not only for the parent, but also for the child, what this means in terms of them being able to develop a relationship and develop healthier self-esteem and self-awareness about it. Let me make sure I answer limited contact with the parent. So as it relates to the actual physical interaction, now one of the things that I encourage children to do, depending on their age, and even if they are young, I advise the caretakers to allow the children to draw artwork for them, to send the parents artwork, to send letters, that kind of thing, so they can have some contact as it relates to the parent. I see another question as it relates to some of the statistics. There's an article, Fragile Families and Child Well-Being, that is published in Future Child 2010, and Waldfogel is the author. And then the U.S. Justice of Bureau of Statistics, as well as an article, Packages of Risk, Implications for Determining the Effects of Maternal Incarceration on Child Well-Being, and then the Annie Casey Foundation's A Shared Sentence, April 2016 Policy Report, Kids Count. All right, so we'll jump back in here. All right, so we've hit on these, definitely the role of poverty when you go to a one income place, and particularly grandparents maybe on fixed incomes, the health, both the immediate health and the health well into adulthood, the separation, of course, and the emotional, mental, or physical unavailability. Parents don't just impart into you their time; they impart into you skill sets. They educate you about how to comb your hair, how to develop relationships, those kinds of things. And so one of the things that I've noticed, particularly in children who are raised without parental input, and certainly in foster care, is that a lot of their social skills are lacking because they have literally many times raised themselves. Another of the unintended consequences when the parent is trying to re-enter is that it increases their, just having some interface with being incarcerated, increases their risk for being impoverished, because it decreases their employment prospects. It diminishes their housing opportunities as well. Let's see. So I would like to spend a lot of my time in the end with there being a lot of dialogue about how we can go forth and remedy and decrease the impact of some of these things that we pointed out on the children. It's easier to build strong children than to repair broken men, as Frederick Douglass articulated in 1855. So let's have some really interesting exchange as it relates to where do we go from here. I'm going to tell you, just throw some things out, but this is a time when I really want to hear from you, because a part of my reason for choosing this topic was certainly not because I had all the answers, but because this is such a challenging and ongoing issue that I deal with in my day-to-day practice as I address adolescents, certainly, and even in the population I deal with who are severely mentally ill. A lot of what happens to them as a result of being outside of the home of their parent, and while they were with someone who became their primary caretaker, that happened just instantaneously without preparation. And as therapists, we work really hard as we are transitioning to another clinic. We have, several sessions to prepare adults for the fact that we're departing, to hand them off gracefully, to, not abandon them. And so if we are, we recognize the importance of doing this with adults, then we should certainly see value and realize that, perhaps these are some of the conversations that we should have with our legislators. As I was putting together this, I learned that there's been some push in certain areas to, if a mother is pregnant, and to delay her actual going to jail by a year so that there can be some parental bonding. I mean, that was that was an interesting way to approach it. I wouldn't have come up with that, but I really like that. See here. So we're going to dive into some of the questions, and ultimately after we hit those, we're going to, I really want you to join me in kind of brainstorming on where do we go from here and how do we have impact. Okay. How do you help the parent remaining at home to understand the seriousness of the child with internalizing behaviors instead of externalizing in response to parent incarceration? How do you help the parent remaining at home understand the seriousness of a child with internalizing behaviors instead of externalizing in response to parent incarceration? That's a really good question. I think for me, particularly a lot with the children that I deal with, and this on some level may be completely anecdotal, and I apologize if it comes off as that. But what I actually do is I pay attention to what it is that the child and the parent are both saying that they are, the child and the caretaker, what they are saying that they want. And I do a lot of questioning along the lines of what's important to them. And I'm blanking on what you call that, motivational interviewing. And so as I delve into what it is the parent actually, the caretaker actually wants, and what it is the child actually wants, then I prioritize my conversation around what their priorities are, and helping them to understand how their goals will be better served if they address this. As you as I talked about earlier, many times the folks that I would encounter would be because they were acting out, either being physically aggressive or because their grades were going down. And so, the grades going down is one area that I let them know if this falls off, what do you want for them? And every parent will always say, I want the best for my child. I want them to have a better life than I did, all of those things. And so helping them to understand that having a better life will entail them, addressing, those things. And for me, when I'm talking to adults, I always say, because people, particularly in the South, will say things like, I don't need a therapist. I'm going to talk to the Lord. I'm going to go to church. I'm going to talk to my friend, or whatever. And one of the things that I say is, you get what you pay for. When you're seeing a therapist, or you're seeing a mental health provider, you are really paying us for our confidentiality. In this day and age, if you confide in your friends, you are more likely to see it on Instagram, Facebook, Twitter, Snapchat, or what have you. And so, in summation, I would say I do a lot of motivational interviewing to try to help them get to what it is they want and why addressing this now and not later is the best thing for them. Can we get Can we get a copy of the PowerPoint info? I don't know. What do you think? Is there been a good audience? Yes, absolutely. What are local resources for these children? I'm so glad you asked. So, in times past, it seemed to be a lot. It seemed to be limited, and with the passing of the Affordable Care Act, with a lot of the Medicaid reform, now children actually have access to treatment. So depending on the United Family Services here in Little Rock, depending on where you're located, you can UAMS actually has a public health services navigation site to where you can go in and click on the county that you have need of services for, and then it can show you what services you need. At United Family Services, they have parenting classes. They have some classes that are particularly tailored to adolescents who are undergoing some of these issues. At Children's Hospital, I'm familiar with, I sometimes, and I don't know if it's good or not, but the Good Grief program, or the Good Morning, program. There's a gentleman whose name escapes me, that he helps me to support, to identify where resources are. So does Helen Wayne, who's at Children's Hospital. There are some, Children's Hospital is always a great place to start. Methodist, and I'm not sure if you are asking me for mental health services or if you're asking me for more supportive services. So I'm giving you the mental health services, but that may not be what you're looking for. Let's see. How would I explain the child's desire to contact parents, to caregivers who, how would I explain a child's desire to contact parents, to caregivers who don't think there should be contact? That's a great question. I think I would explore with them what their reservations are, because there may be some really legitimate reasons for that as it relates to, if the child was sexually abused or something like that, by the parent. I would, try to understand where they're coming from more, and then, contingent on the child's age and where they are, I would look to trying to more to tailor it to if the age is right. I would, definitely point to some of the literature that suggests that children who have contact with their parents while they're incarcerated fare better from a mental, emotional stance. I definitely would, I would have that information ready and on hand to talk about it. As it relates to resources, PRI has TFCBT, trauma-focused cognitive behavioral therapy, Psychiatric Research Institute of PRI. Greg Adams is a social worker at Arkansas Children's Hospital who runs the Good Morning program. United Family Services offers pre-parenting classes, free anger management classes. There's no referral needed. You can contact Sandra Williams at 501-376-0111 for more information. There is Family Matters is out there, but I'm not sure where Family Matters is, so if someone knows that. ARBEST offers TIA, trauma-informed CBT training as well. And you guys, please send in your answers, because that's exactly what we want to hear. Now, next question is, it is definitely cyclical. I personally believe that education can drive several of these different areas. If people are more educated, they're more willing to open their minds to things like caretaker support and treatment and reform and social services. And what I would say as it relates to that, I would go after the fact that that person obviously wants what's best for the child. And sometimes, I'll say, let's say you're absolutely right, and this child should not. But let's say you're wrong, and what's the fallout going to be? What is this going to look like? And I really try not to come off as, I know what's best for you, I know what's best for the child, and be dismissive. I really try to engage them and get to know better what their reservations are so that I can address those. Let me make sure. Great, we're doing really good on time. I think we hit all of the questions here. I have, okay, yes. So now we're going to get back to where do we go from here. So what we do know is that the people who become the primary caretakers, their stress definitely goes up. Supporting them. Many times they are the folks who are bringing the children in, but really pressing in upon them in a very respectful and graceful way. The fact that that they also need someone they can talk to. I remember working at a particular agency, and the grandmother was a person of faith who was taking care of her granddaughter, and the people at church. I guess her daughter was someone who was in and out of the system, and so people at church were really discouraging. I would say we should be able to start with our current level, our current circle of influence, and influence that. If you you educate yourself and make sure that you work with faith-based communities, you work with places like United Family Services, ARBEST, with Family Matters, with those different agencies to know exactly what's offered so that you can have that and hand it out. My good friend Chad Sievers over at ARBEST is just a bundle of knowledge and can definitely connect you with things that are there. But also, as we're having these conversations, you notice early on we talked about 50, greater than 50% of those who are in federal or state prisons, it being related to drugs. One of the things that I discovered was that in the 70s, it was suggested, a commission suggested to Nixon that they not have sentencing for marijuana possession. He ignored it. When Clinton was in office, he ignored it. And so what we're seeing now is the war on drugs, and I don't mean to sound political, I'm really just trying to say this, but the war on drugs has definitely impacted families and has impacted the very fabric of our community, and we are all taking up and paying the cost for it. It's not just an individual issue, as you can tell. The taxpayers are kicking in as it relates to prison costs, as it relates to SNAP, as it relates to housing costs. We're all paying for this, and so we are invisible victims as well, and it makes sense that we would have some informed discussions with our legislators and let our voices be heard, whatever your thoughts are. It makes sense that we, I think July 14th, Congress passed something related to comprehensive treatment for opiate abuse, opiate dependence. I think that's a great start with our legislators. They've been paying a lot of attention to prescription drug abuse and really, jumping in and having some intelligent conversation about that. Getting familiar with the research, realizing that it's much cheaper to go to rehab and get treated and have support services available. I imagine that rehab is a lot cheaper than $26,000 of incarceration for 1 year. So having those kinds of conversations and providing some support for the children. In Atlanta, they have a program for children who have parents who are incarcerated, so that it's a mentoring program. Getting with people and working that. There needs to be an increase in monetary support for the children left behind and their caregivers. And it sounds like a reasonable suggestion. It sounds like something that a policymaker should hear. And so when you have those conversations, be informed with Annie Casey's Foundation's policy report from 2006, Kids Count. It's called A Shared Sentence, the Devastating Toll of Parental Incarceration on Kids, Families, and Communities. Many times, we don't do anything because we don't know where to start. But when when you get this report, it's about a 20-page document, and it goes on, to talk about the toll that it takes, the children and the families that are left behind, what parental incarceration means for kids. It talks about the added financial burden. It talks about the impact of child and family health and well-being, the drain on community resources and opportunity. Now, I have to tell you, whenever I'm having a conversation with my husband, he is not particularly interested in my emotional plea. He's interested in the dollars and cents of the matter. And so when you go into this policy report, they talk to you and they outline the dollars and cents of the matter. And the program that I was talking about, the after-school leadership program, is called Atlanta's Forever Family. That is an after-school and leadership program for children and teens with incarcerated parents, creating space for them to interact with peers and coordinating visits to prisons. Girl Scouts also had a program. I don't remember the name, but it was a program for people who were incarcerated to be able to interface with their daughters through Girl Scouts. In New York, the Center for Community Alternatives offers mentoring and support groups for Syracuse public school students whose parents are incarcerated. So there's some programs out there. The issue is these days that people will do programs, but then they don't evaluate the programs. And now we've gone to an evidence-based approach. And so, when legislators are saying, where's the evidence for that? Well, many times they know that there's some good outcomes, but they didn't actually document it. So it begs the question if we need some additional research that is case controlled as well. I think the monthly, I am not sure what this statement means. I think the monthly is $80 for the first child and $40 for the rest of the children left behind. I don't know what that means. Let's see. What can be done to increase access to incarcerated parents? Can audio FaceTime type of visitations become available? It is difficult to get visitations as therapists in the prisons. I get the punishment aspect of prison, but these children don't understand. I mean, you raise a very valid point. Now, for me, that it goes back to, it sounds like just good common sense, but, we know that common sense isn't so common these days. And so, it says to me that, these are the kinds of conversations that we need to be having with legislators. Get to know your legislator, invite, if you are part of a nonprofit organization or a faith-based organization, invite them out to have these kinds of conversations. One thing that I can say is, in the mental health and in the mental health world, sometimes we get so bombarded and overwhelmed with all the competing demands of taking care of these children that, or these youth or these families, that we don't always realize or take the time away to actually put into practice the advocacy part, because we're just overwhelmed. This is why having these kinds of conversations and these kinds of forums is so important. And one can chase 1,000, two can chase 10,000. When you put a group of people who are like-minded, who have a passion for improving outcomes for children, you come up with brilliant ideas. I have to tell you, as commonsensical as this audio FaceTime is, it didn't cross my mind. And so you're having conversations. Now, can you tell what that person's name is? Lisa Abuja of Abuja Counseling Services in Fort Smith works with Sebastian County Juvenile Services to help parents steer children away from the juvenile detention or probation system, and helps with the Accountability Starts Here program for the juvenile court. So that's some great information. We only have 5 more minutes, so please get your questions in. As it relates to one of the things that I want the therapists or mental health providers to realize is that when a child is bouncing around into different places, it increases their risk for childhood sexual abuse. And so making sure that that we have some prevention services in place, in terms of educating the caretakers about how to protect the children as well as the children, rather than responding to this, is really important as well. And what does CAC stand for? CAC. Child Advocacy Centers. They have a lot of information out there about those kinds of things. Really pressing and encouraging not only your patients but the people that you know, just being able to anticipate that there may be an impact on school. There may, likely there will be. There may be an impact on relationships. But there's the whole shaming thing that happens, and really aggressively preparing the caretakers. Starting there will be really, really helpful, and getting over the whole stigmatizing bit of reaching out for help. That's a great place to start. Let's see. I don't have any additional questions, and I want to be respectful of your time. So if you have any additional questions, please email cmsievers@uams.edu.
Thank you, Dr. Maddox, for such a great presentation. For folks who are interested in getting to see you, the code is displayed on the computer screen right now. And just remember to tell me your first and last name. And a lot of these resources and articles that we brought up on today's webinar, I'll make sure to send out just kind of a blanket email to folks so they have a lot of the information. I think that's a great point, just to get to know the folks around you and influence your own circle, because there are resources that I think I know everything, and oh my gosh, never heard of that program, and it's wonderful. So I'll be sure to send an email with some of the ones that we highlighted today. I'll leave this slide up for a little bit, but if you have to go to your next thing today, please feel free to do so. And otherwise, we will hopefully see you or hear from you next month in August. So, and we'll be on the line for another minute or so to answer any other follow-up questions.